Hello and welcome to GBMC's Greater Living Live. I'm Mary Beth Marsden. Thanks so much for joining us today. Today we're talking about something that is so important to our well-being. And I guess in order for you to really listen to our conversation, you have to be able to hear it first, right? So that's why GBMC's Hearing Health Initiative is so important. And joining us to talk more about that today is Dr. Regina Marie Presley, who's the Director of Audiology with the Presbyterian Board of Governors Cochlear Implant Center of Excellence at GBMC. Easy for me to say, right?
Good
Thanks so
morning.
much for being here. Good morning. And Dr. Kevin Ferentz, who's the Chairman of Family Medicine at GBMC, also joining us. Dr. Ferentz, thanks so much for being with us.
My pleasure.
All right. Dr. Presley and Dr. Ferentz, we're talking about our ears, we're talking about hearing. I think oftentimes until we have a problem that we think we have with it, we're not thinking about it at all. But it is so important to both our emotional health, our health as we're aging, and it affects us in so many ways. I don't think people generally think about it so much. So let's start, Dr. Ferentz, with the Hearing Health Initiative and why kind of you're involved too. We understand why Dr. Presley is very crucial to it, but you've been brought into this as well.
I have. So several years ago, Dr. Brian Kaplan, who's the chairman of the Department of ENT, who's a good friend of mine, brought up the possibility of us starting to do hearing screening in a primary care setting. I work in an office with another family physician, Dr. Kevin Carter, and we typically do hearing screening on kids, on little kids. That we've been doing forever. But Brian brought up this possibility of starting to doing screening on older people, people who have diabetes, people who are coming in for their annual physical over the age of 50, because so many people do have hearing loss and don't realize that they have it. And interestingly enough, we don't have the data that says that doing screening makes a difference. It's what's called an I. We don't know. The US Preventive Service Task Force says we don't know. So we said, well, why don't we find out? And so we are now doing something that really could have just international impact. If indeed we start screening a whole lot of people and we realize, my goodness, look at all these people who have hearing loss that didn't realize that they had it, and then they have intervention and potentially prevents them from dementia and improves their quality of life. And we may wind up changing the recommendations so that every family physician and internist and primary care provider actually starts screening people for hearing loss. It really may make an unbelievable difference.
Well, I can see how excited and passionate you are about the potential for this program, Dr. Ferentz, and I want to talk about the dementia link to hearing in just a moment. But first, Dr. Presley, you see people once they develop a problem or think they have a problem. This must be very heartening to you to know that there's some screening happening hopefully, way ahead of time.
Well, it's really important for us because we know that most people really don't come to getting hearing health care until the problem is more severe and it's invisible, right? So you can't look at someone and know they have hearing loss. And for most of us, it tends to be a very gradual process. And early identification means that patients do better, they have better outcomes with their management. And it has such a tremendous impact on not only our quality of life, but our health. And that's why we want to stay on top of it. We want to identify early. And that's how Dr. Ferentz and I have come to partner with one another to be able to bring this to the patients at GBMC.
And Dr. Presley, let's just talk about how many people we're talking about here are affected by hearing loss. And I think we have some graphics that we can show too, some images to give people some of those numbers and ideas about that.
It's more mind-boggling than I think that we realize. There are about 40 million Americans who have hearing loss, and it's becoming more prevalent, especially in our teenage population. And so it's imperative that we make sure that people understand that hearing health is important, and we need to be proactive about it instead of being reactive.
image and it said 1 in 5 teenagers experience, American teenagers, some sort of hearing loss. Is that growing, and why is that happening?
That is growing, and that's occurring because we have a lot of devices now that are in our ears and they're being played loudly. And when you take a loud sound and you put it in a really small space, it creates damage. And most hearing loss is irreversible. There's very few hearing losses that occur that can be medically managed. So we want to practice safe listening. And we want to make sure that we're identifying things early and managing them appropriately.
And Dr. Ference, I would imagine that now you're kind of like helping to head up this initiative. You're talking with your patients a lot more about the importance of hearing and what to be on the lookout for, and that would include teenagers as well.
Indeed. Yeah, something that we would never have talked about with teenagers, especially. So this is becoming like a sort of a front and center sort of thing that had never existed before.
Yeah, I mean, I am very sensitive to it as well. I think I've talked with Dr. Presley before. I do have a little bit of hearing loss in one ear, and now we're all out and about much more since COVID. A lot of people are taking in live music, whereas for a couple of years they did not. And it's really made me think about wearing protective devices in my ears because of that. So it is more top of mind, I think. Dr. Ference, you brought this up, and I want to touch on it for both of you. But first, Dr. Ference, I don't know that people realize how important hearing is and how it can affect other issues, i.e. dementia, in older people.
Well, don't feel bad because I actually didn't know this as well. Since we started this whole project, I've learned a whole lot more about hearing loss and the impact of hearing loss than I learned in medical school and residency. And Regina is my constant teacher. She's always telling me, teaching me things that I don't know about. So my understanding is that at this point that mild, untreated hearing loss doubles your risk of dementia, and a moderate hearing loss makes it 3 times more likely that you will be demented, and a severe hearing loss is 5 times more likely to develop dementia. So what an unbelievable thing we can do to impact patients and people who may wind up going on to develop dementia that don't have to, because we can identify their hearing loss and have interventions to help them.
And Dr. Presley, can you touch on why people still might not, they can hear you say that, but what is the connection? And also we saw all these other diseases that are potentially connected with hearing loss.
And so I think nobody has to feel bad about the link between cognition and hearing loss because that is more recent, and we continue to gather information about that. But the idea is that we use a certain area of our brain when we're hearing. And when we can't use that part of our brain anymore, that information needs to go somewhere else. So what it does is it impacts another area of our brain, and it puts our brain in overload is the best way to describe it. We call that cognitive load, and that means that it's harder to do things like organize our thoughts. It's going to impact how we're processing information. It's going to impact our memory. And the longer we go without that input, the harder it's going to be. And so the sooner we identify hearing loss and we get that information that patients can be successful in their hearing, it lightens the load and we see improvement in our ability in all of those areas.
Dr. Presley, what are some of the common symptoms that someone may notice without realizing it's directly hearing loss, but what are some of the things they might notice socially, for example, that could indicate a problem?
So one of the things about untreated hearing loss is that we'll see an increase in depression, we'll see an increase in isolation. And I think sometimes people don't even realize what's happening is they're just like, oh, I don't enjoy doing that anymore, right? But really what it is they're not enjoying that social interaction because communication is difficult. And they can't follow a conversation or they feel that they look silly because they answer inappropriately. I think those are some indicators, and it might be that a significant other may notice that before you even notice yourself. But at home or in a work environment, if you're asking for repetition, if you're having trouble following the conversation, if your partner says the TV's up too loud, the telephone's harder to hear unless you're increasing your volume, you're having ringing in your ears, all of those things are indicators that you should probably have at least a screening done, if not a full evaluation.
And Dr. Ference, specifically, how are you screening at all age levels?
Well, we have a device. It's very simple. It's a pair of headphones that go on people's ears, and it's a very simple device to use. Takes 2 seconds to really learn how to use, and we screen at four different um, hertz. I can't think of the word to use, but at different like pitches, right, of sound, and then how loud the sound has to be for the person to hear it. And if a person fails two different levels at a certain amount of sound, then we refer them to formal screening.
And you talked about the implications of this, and this is a question for both of you, the implications for this worldwide. So I'm assuming this is a specific study, or will it turn into a study, you hope?
Yeah, I think we do. My understanding is that there are other offices that are going to be collecting data in America. And theoretically, we could be presenting data to the US Preventive Service Task Force down the road, showing that actually screening asymptomatic people, which is really what we're talking about here, if you are screening asymptomatic people, that it will have a positive impact on their lives. And then that's a game changer. Then that becomes every primary care doctor, every primary care provider has to start doing routine screening for hearing loss, which is something we are clearly not doing at this point.
And Dr. Presley, is this something that if someone is asymptomatic and it's all part of the process of just screening, like you would screen an eye test, I guess, is this covered by insurance, or we haven't crossed that bridge yet?
So it is covered by insurance, but I think the important thing for us to think about is, again, we're looking at being proactive. And the reason being is that someone who has untreated hearing loss is more likely to be at risk for falls. They're going to be hospitalized more often than someone without hearing loss. Most people we find leave the workforce earlier because they cannot be successful. And for those who remain in the workforce, the research shows us that people with untreated hearing loss actually make about $20,000 less than their normal hearing peers. And so I think those are reasons, just like we do everything else. You can go to the pharmacy, right, and you can get your blood pressure screened. There are ways to be proactive. And I think for all of us, we all need to be active in our own healthcare because hearing is connected to other health issues. And if we're staying on top of these things, it's really the holistic approach that GBMC prides itself on.
Dr. Ference, have you had any surprises yet? Because you've started screening everyone, I'm assuming, at people who have some level of hearing loss that had no idea?
Yes, we have made several referrals. We're just sort of getting this off the ground. We're screening everybody over the age of 50 who comes in for an annual physical, and we're screening our patients with diabetes. And certainly anyone who comes in with any complaint about their hearing, we're also doing testing in the office. But this is not a device that we used to have, right? Primary care doctors don't have this in their office. We used to have a much simpler device that we would use to screen kids, which, as I said before, was something that we have routinely been doing, but we didn't do it in adults. And so, like I said, potential real game changer.
And Dr. Presley, you had mentioned that once you do start to lose your hearing, that's not something you can get back. So what do we do? How can people, once they've lost it, what options are there for them? Or how do we prevent it from sliding further?
So certainly that safe listening that we were talking about earlier is the best way to practice trying to maintain hearing loss. Some hearing loss may be naturally progressive, and so we want to capture a treatment option certainly as quickly as we can, and that will continue to be monitored. But the options in terms of how do we help people with hearing loss would be look at the use of hearing aids or implantable devices like a cochlear implant or a device called a Baha. And we see really great results when we utilize that technology.
Are there other therapies too that have to be involved? Do you have to get involved with speech therapy or learning to navigate a crowded room, or how to recognize signs of depression?
So we do look at all of that, certainly. From a pediatric standpoint, obviously, we're looking at developing speech and language and making sure that children have the skills to have proper access for language, reading, writing. From an adult standpoint, we do provide oral rehabilitation. So whether it's getting used to having new sound and understanding the equipment to relearning to listen if you're using a cochlear implant and you've been without hearing for a long time. And we're able to provide those services pretty seamlessly, so we can do it in the comfort of your own home on a video chat, or you can come into the office for that.
Isn't it pretty recent too that hearing aids, either they are or going to be sold over the counter soon?
So there has been approval for over-the-counter hearing aids. Those devices are really designed for someone who has a more of a mild hearing loss, where they just need a little bit of boost to be able to hear. But as hearing loss becomes more severe, that really needs to be pursued through an audiologist, because those devices are going to be a little bit more complex.
And Dr. Ference, I would imagine, especially when you're working with children, I seem to recall teachers will often be another frontline group of people who will notice hearing difficulty in a student, which sometimes turns out to be something behavioral, but it's an indicator in some way, right?
Yeah, it does. And there are some school systems where they actually do hearing screening in the schools. So not just in the family doc or the pediatrician's office, but they may actually do formal hearing screening in school systems.
Dr. Presley, are you sensing, not only are we having this conversation, but are you sensing an overall increase in awareness about hearing loss in general?
Well, and I would say for our field, really that's the mission of what we need to move forward. We've learned so much about the impact of hearing loss, and what we do know is that there's still a lack of education. And as Dr. Ference said, that I was able to share information with him that he may not have been aware of previously. But I think for the general public, I think that there's a lack of understanding about the importance of hearing health. And we're really trying to make sure that everybody has the awareness and access to this information so that they can be champions of their own health.
And Dr. Presley, obviously technology moves so quickly. Is there anything on the horizon that's new and exciting in this field?
I would say that there's always something changing. So even when we look at hearing aids and we look at cochlear implants, there's always a newer version coming out, a lot of access to connectivity for patients. So our patients can connect to any device like you do every day. So your phone, wireless connectivity, that's terrific. We're looking to see better efficiency, better sound quality. So it continues to advance. And then certainly from a technology standpoint on our end, what we're able to do remotely and to be able to access patients and make things convenient for them continues to improve as well.
And Dr. Ference, I would imagine you probably have teenagers who come in with earbuds in, right?
Oh, all the time.
So you're having that.
Yeah, it's really challenging to tell kids to actually take things out of their ears. In the old days, you had to go to a bar where it was the sound was unbelievable. But you would, even when I was in college, I mean, if you would leave a bar where a band had been playing, and you had ringing in your ears for several days after that. So we damaged our hearing plenty in the old days as well.
All right. Yeah, I think you're right about that. So hopefully we can hold on to what we still have, right? That's the goal. If I want to learn more, if anyone watching wants to learn more about the Hearing Health Initiative, where can we go? Either one can jump in.
Yeah, I was going to say we can. I think the best place to start is Dr. Ference's webpage, which is if you type in his name or do GBMC / and then put Ference in, it'll take you there, and there'll be more information that will be coming as we continue to gather information.
Yeah, I
And
mean,
first, go ahead, Dr. Ference.
really is we're just starting in one of the offices at GBMC. As we start to see how successful this program is, and I have zero question about whether it's going to be successful, it is going to make a big difference, then we have a second office in Owings Mills that we will then try to get the instrument as well for screening. And then I anticipate this is going to roll out to every one of the primary care offices at GBMC.
What is your time frame, hopefully, of expansion?
I certainly, over the year, I would think we'll be expanding dramatically. I mean, we really are just sort of getting off the ground, but after we have several hundred people screened over the next 3 months, 4 months, 5 months, I would imagine we'll have enough data to say, you know what, we really need to be doing this everywhere.
And Dr. Presley, if currently your general practitioner is not providing this specialized testing or screening, and you do want to get your hearing tested, who should you contact?
You can contact GBMC Audiology, and they'll go ahead and schedule an appointment to do an initial assessment. And it's great, regardless, to, just to get that baseline. So I would encourage anyone to do that.
All right, Dr. Regina Presley, thank you so much for being with us. Dr. Kevin Ference, thank you both for joining us. I hope a lot of people were listening and hearing, and we appreciate all the efforts that are being made.
Thank you so
Thanks.
much for having us.